Hey guys, Doc Heps here. So did your doc call you and say you had a UTI and prescribe you some antibiotics, but you felt great and you're wondering what's going on? Well, stay tuned. Hi guys, Doc Heps here. So we're going to go over what an actual urinary tract infection is versus so-called asymptomatic bacterial colonization, when your urine grows bacteria but you have no symptoms. Let's go over what a urinary tract infection is. So a urinary tract infection is when a patient has symptoms of urinary urgency, frequency. They have potentially blood in the urine, burning with urination, and a constellation of pelvic pain, along with a urine culture that grows bacteria. That's called a urinary tract infection. And that can come in different permutations and different symptoms. Whereas occasionally, you'll go into your primary care office or your urologist's office, and a nurse or somebody may order a urine culture and you're feeling great, but it's just ordered routinely, and they call you back and you have a urinary tract infection. So what does that mean? Well, many folks, for different reasons, will have what's called asymptomatic bacterial colonization. And what that is there's bacteria in the urinary tract, but it's not causing an infection. And typically, as urologists, we don't want to treat those. What we worry about is over-treating these, and all of a sudden you're developing resistance to that antibiotic. We're selecting out bacteria, and it's harder to treat if we keep giving you these antibiotics, because all of a sudden those antibiotics won't work anymore, and we're stuck with using only intravenous antibiotics, or you've developed such a resistance pattern that no antibiotics will be effective. So in folks who have no symptoms, but they happen to grow bacteria that is tested for some reason, we as urologists tend not to treat those. Now, people who have asymptomatic bacterial colonization are typically folks who have some underlying urinary problems, and these folks may have catheters. So for example, if you have difficulty voiding and you're stuck using a urinary catheter, very commonly you'll be colonized with bacteria. There'll be normal bacteria in there, and as long as you don't have any symptoms, we don't treat. Other things that can cause asymptomatic bacterial colonization include bladders that don't empty. So if you don't empty completely, yet that bacteria may be difficult to eradicate. And again, as long as it's not causing you symptoms, we don't treat. If you use a catheter to drain your bladder, so if you do what's called straight catheterization or intermittent catheterization, oftentimes people will put a catheter in to drain their bladder a few times a day. And those folks are often, quote unquote, colonized. And so if they were to get their urine tested and they were doing fine, they'd grow bacteria. But again, that's asymptomatic bacteria in the urine. Colonization, don't treat. Folks who've had surgery or reconstructed bladders or have a urinary diversion oftentimes will have asymptomatic bacteria in the urine. And again, we don't treat that. I'm sort of harping on this because as a mandate from the urologic and infectious disease societies, we try to limit the use of antibiotics to those folks who really need them. If we overutilize those antibiotics, we're going to develop resistant bacteria, which are harder and harder to treat and can make you more sick. So as urologists, we try to use antibiotics strategically and only in those folks who are developing symptoms. So now sometimes it's a tricky road. Sometimes you're not sure. Are you symptomatic? Are you feeling okay? And oftentimes if the culture grows bacteria, we'll more commonly than not try and treat you to eradicate any problems you are having. Bottom line, there is a big difference between having an active urinary tract infection and bacterial colonization. In an active infection, you will typically have symptoms, and traditionally these are urinary symptoms of urgency, frequency, burning pain, pelvic discomfort, and we will treat that with antibiotics based on a culture that is obtained from the urine. If you had a culture for some reason, routine testing, so forth and so on, and it grew bacteria and you're not having any symptoms, that's called asymptomatic bacteria in the urine. And oftentimes we as urologists will just monitor that and ensure nothing else is going on. This is Doc Habs. Thanks for watching. Subscribe to our channel. Check out our other videos. I think you'll really enjoy them.